for which I am preparing you. If your subjects are not clear today, tomorrow you saw, yesterday you saw how difficult it was for you to study the subjects. So clear your topics quickly. Next. So female versus male, you'll get male most of the cervical spondylitis in female earlier, but now it is not like that. You get it in the male also. They are type non-specific and with plus. So generally because of the lifestyle, you may have because of any specific reason, you may have spondylitis and generally because of with plus, you may have this pain. Now there are two types, cervical spondylitis and acute torticollis. Torticollis means involuntary movement of the muscle movements, and cervical spondylitis means degeneration of the cervical spine. Yes, please come in. Come in, please. I'll put the needle. Come here. Come this side. Can I, doctor? Someone will take it out. Hmm? Someone will take it out. After 20 minutes? Yes. So, acute torticollis is very difficult to recover because it becomes an involuntary movement of the cervical spine. It becomes like this. But with the help of cervical acupuncture, you can recover acute torticollis also, and 70% of the 7 cases of cervical spondylitis. So, assessing neck pain, you must in this type, you must exclude musculoskeletal causes, assessed for red flags. What are the main uh, chances which may deteriorate the case? Assess the range of neck movements and perform a neuro examination. So you must assess the neck movements. What kind of neck movement, how much neck movements you can do, and then perform a neuro exam. It is very important for a case in cervical spondylitis. Next. Identify risk factors for developing neck pain. So you must identify the risk factors which may develop the neck pain. Identify psychological factors that may suggest increase of chronicity and disability. Now in here, if it becomes disability, it may lead to myelopathy. There are two types of disability which we see. What are they? Cervical myelopathy and myelomalacia. It comes leads to paraplegia and quadriplegia. What it leads? Paraplegia and quadriplegia. Third disability is wasting of muscles. Gradually, there is a wasting of muscles in the hands, and as a result, your hands become disabled for what? Doing any work. Can you hear me? Can you hear me?
Yes, Sastri ji.
Yes, sir.
Yes, sir, you're audible.
Yes, sir.
Four.
Yes, sir.
Now you must identify the risk factors for developing the neck pain. What may be the risk factors? What is the life history of the patient? How is the patient living conditions, lifestyle? So a Nigerian lifestyle is different, Indian lifestyle is different. So you must identify what can be the lifestyle reason for having this pain. It may be psychological, sociological also factors. So people do not have real neck pain, but they develop a psychological reasons. So these two things you have to identify. Pathological reasons, the real reasons for the pain, and non-real reasons for the pain. It may be psychological. Oh, I have a pain, I have pain. And it may be non-psychological. Means it may be a what? A pain. Next. Next. Individual positive finding must be interpreted with care as the positive predictive value for diagnosing serious disease in poor. So you must have positive findings must be interpreted with care. See, all this care you must take to predict what is the case of spondylitis. Where is the disc prolapse? How much disc prolapse is there? Protruded, extruded, canal stenosis, myelopathy, myelomalacia, osteophytes formation, OPLL. So there can be anything in the cervical region. Any of your wrong diagnosis may lead to the death of the patient. The diagnosis of the patient is most important while treating a patient. Now, what are the red flags you must consider? It may be metastasis cancer, it may be infection or inflammation. In metastasis cancer, you will see generally it comes from the lungs or from pancreas or anywhere. Generally, it is from lungs. You will see the metastasis in the lungs, and the patient will be quite a unexplained
Sir, your voice is up and down.
on
Sir, you're not audible, sir. We can't hear you, sir.
I believe his network his bandwidth is low. He'll soon come back.
Yes,
Yeah.
yes.
Your mic is off, sir.
Get my mic. So what are the red flags? Red flags that suggest cancer, infection, or inflammation. The history of inflammation. It is inflammatory arthritis. It is ankylosing spondylitis, cancer, tuberculosis, immunosuppressant, drug abuse, AIDS, or other infections. Red flags that suggest cancer, infection, inflammation must be lymphadenopathy, execute localized tenderness over a vertebral body. So when you examine local, you will see there is a very much tenderness. So be careful. Go for MRI or PET scan immediately. Immediately, first advice for investigation is MRI, not X-ray. First investigation is what?
With MRI.
MRI.
Yes. Then PET scan. PET scan is done to identify where is the primary cancer and whether the patient is only having spondylitis. It will identify from the X-ray, from the MRI. What will be the MRI? MRI cervical spine, all spine screening. MRI cervical spine, all spine screening with if required
Contrast.
contrast. If required, let the radiologist see. Normal, if required, contrast. If you see abusive factors, if you see cancerous factors, you may go for contrast studies. If he does not see, he may need not require. One minute. कौन है क्या हो बेटा कुछ हुआ कौन सा मशीन है दिखाओ तो क्या है मैं क्या ऑर्डर दिया 1 लाख का भी उसी के साथ है ना लक्ष्य हाँ उसी के साथ वो ईजी एमजी सभी एक साथ वो स्किन मसल पीछे का जो टेस्ट करता है ना वो है ये red flags that suggest severe trauma or skeletal injury, history of violent trauma, fall from a height. However, minor trauma may result fracture in spine with osteoporosis. See, very difficult. We must be very careful in old age people. When after 15 in menopause, osteoporosis. अब osteoporosis का मतलब जानते हैं osteoporosis का मतलब होता है the reduction of calcium in the bone. But these days we find osteoporosis in the young people. Tell me why? Because of the TDS value of the water. If the TDS value and pH value of the water is less, then also you become what? Osteoporosis. Am I clear? Red flag that suggests severe trauma or skeletal injury, a history of neck surgery. You have to be very careful. Risk factor of osteoporosis, premature menopause, use of synthetic steroids. So you must be very careful when the patient is using any type of osteoporosis, is having osteoporosis, premature menopause, before the age he becomes menopause, or systematic steroids. So if he is using systematic steroids, the bones will become weak and then there may be a there may be reflected vascular insufficiency, dizziness and blackouts, on movement, especially extension on the neck and gazing upward. So dizziness and blackouts you can see, and on movements you will see, if the patient sits upward, you will see some type of blackouts is there. You have to be very careful. These are red flags. Red flags means it's a sign of not good. These are not spondylitis. You have to be careful. The patient have gone beyond something which has not been your cure. So you must know what is in your care and what is not in your care. Next. Red flag that suggests vascular insufficiency is drop attacks. So you will have drop attack. You will have like this. Suddenly his neck will drop. So you must be very careful while using that. Like this.
Please show, yes. Okay.
Like this. So before understanding the techniques of treatment, your diagnostic technique must be very clear. I think that we'll continue with this free classes for more time, and because many more class things have to be clear to you.
Thank you, sir.
reflex suggests compression of spinal cord. That is called myelopathy. Whenever there is a cord, I told you indigenous progression. Whenever there is a large disc prolapse for continuous time, there may be a swelling or edema in the cord. This is called what? Cervical myelopathy. It may lead to paraplegia, quadriplegia, unmovement of both upper limb and lower limbs. And it may also lead to what? Lifelong bedriddeness. We have recovered many cases of myelopathy and myelomyalgia in our cases. But it takes time. Once the cord is damaged, the connection with the brain is broken. You cannot recover it with simple process. And please do not try, even the orthopedic surgeon do not try it. They just leave it. The neurosurgeon also leave it. They say the patient has to be lifelong bedridden. Although I recover it, but you do not do it. So what are the things you'll understand because of the spinal cord myelopathy? Neurological symptoms, get disturbance, clasp me or weak hands, loss of sexual bladder or bowel functions. This is neurogenic substance. You'll see wasting of muscles, thinner muscles you'll see wasting. You will see a lot of things. Thinner muscles has to be excluded with motor neuron disease and other diseases also. So the right diagnosis is done by MRI. Am I clear?
Yes, sir.
Yes, sir.
Any questions up to now, please ask.
Clear, sir.
See, most important part, this is what excluded in Western diagnosis and Eastern diagnosis is they consider pulse, this. But this does not diagnose myelopathy, spondylitis, osteophytes formation. That has to be diagnosed by the modern diagnostics. Integration of modern diagnostic and treatment of the traditional diagnostic in a modernized way recovers the patient quickly. This is what I do. So you see signs of Babinski signs in the hand, upgoing plantar reflex, hyperflexus, clonus, spasticity. These are the symptoms of what? Neurological signs. You see the upper limbs are going, Babinski signs are going upward, means the leg is going upward side, upgoing in the plantar. Reflexes are hyperflexia, clonus, and spasticity. Next. Reflex suggests compression of spinal myelopathy is neurological signs, Lyme signs in upper limbs. Atrophy of hyperflexia means you see the atrophy in the upper muscles. So you must be careful whether it is myelopathy or this one. Next. Never try to treat myelopathy, myelomyalgia, severe spondylitis. Even the neurosurgeon does not try to do it. So you also don't try to do it. Next. You see sensory changes, variable areas, loss of vibrations, joint position, sense of more evident in the hands than in the feet. So here you can see sense are more evident in the hands than in the fit, but it is not like that. We have seen myelopathy in RTA, road traffic accident. People upper limbs are more evident than the lower limbs. Even we have a quadriplegia patient whose upper limb has recovered nicely, but lower limb is supposed to recover. See, in any kind of radiculopathy, which is radiating, X-rays are not advised because you can only see the disc space. If you are not an expert of disc space, if you are not an expertise, better never go for X-rays. You must always go for MRIs. MRIs give you specific direction where is nerve compression, tumor, seedings, or anything. If you have, you can diagnose it with the help of what?
MRI.
MRI, sir.
MRI. And many of the cases, you can 70% of the cases, 80% of the cases does not require surgery. Only 20% of the cases require. So you have to identify some which you can treat, which you cannot treat. Diagnosis of the patient is very important. History and diagnosis. These are the two things which are very important for any cases of cervical radiculopathy. Yesterday you saw last night one patient came to me who was having severe pain because of trauma in the head because of sinusitis. I just injected one injection over here, only over 1 year, little bit, and his headache is gone. 2 or 3 times he took steams, and then his headache is finished. It is best to go for the investigations and release the patient from pressure. It is always best that we investigate the case, what kind of case it is, and then go as per that. Do not do any type of chiropractic, do not do type of any type of such practices which may lead to what? Danger to the patient. Next. Here you can see degenerative changes in the spine. If you see, these are called the disc changes. You can see the above spaces and you can see the lower spaces of 2, 3, 4 and 5 and 5 and 6. You can see these are called the disc prolapse changes. So here you will see these the changes of the facet joints of cervical spine. These are generally the cervical spine changes and it illustrates the cervical spondylitis. So these are the changes which you have to see. But then this shows only one primary investigation. MRI is must. If you see any such changes in the spine, please be careful. You must see the MRI. Do not prick the needle here and there. Go specific, do specific, and you get specific results. It is not that the neurosurgeon only can get the specific results. You can also get the results. I tell you, 80% of the cases or 70% of the cases do not require surgery. Only 20 to 30% cases require surgery by a competent neurosurgeon. Depends on clinical picture. So you can see the clinical picture here. Next. Abnormal neurology persistent with progressive brachialia without abnormal neurology warrants neurosurgical investigation. So all neurosurgical investigation means MRI becomes under neurosurgical investigation with NCV test, whether the nerve is injured or not, which nerve, radial, medial, or ulnar. So that part also has to be seen because this changes once happens in the body, it may not recover. So that part you must be examined and be careful if you have such changes, go immediately and try to recover it. Making delay will lose your upper limb, lower limb, and you will become handicapped for your whole life. More cases. Surgery is less good or reducing myelopathic symptoms than when these are chronic. So surgery is not advised. That is why I said this. Your role is very important. Surgery cannot be done in myelopathic changes in advanced stages. It has to be done by acupuncture and palliative care. That is your role. And if you forget your role very nicely, if you do not understand the subject very well, if you do not understand the history of the subject very well, what will happen? You will never be able to treat the case. You will never be able to sign in your career. You will never be able to be successful physician. History, reduction, learning, pointing, and recovering. Pricking needle here and there will not help. Pricking location, you see, I have been recovered blepharospasm, bell spasm, which was Botox injection, and I have just recovered it with simple needles, and it almost flickering his eyes, almost gone. He came for spondylitis, I recovered this. And in how many minutes I recovered? Only 1 minute. So I told you there are a large number of diseases which you can recover. The only problem with you is that you try to recover those diseases which you cannot recover. So axonal neuropathy, motor neuron disease, you cannot recover because these are deadly diseases. Once they happen, they cannot recover. There is the specific and set up specific requirements, specific physicians and neurologists that they prescribe one medicine. It is not enough. You have to recover these patients in a proper way. Other muscle dystrophy will be there and the patient may die. That is the most important thing which may happen. So please do not try to take risk in your career. Play safe, be safe, and you have a beautiful career. So urgency becomes immediately required when you see severity of symptoms or deficit. Deficit means he cannot move. At that time, surgery may be required. But surgical, after post-surgery, deficits are there which can be recovered by acupuncture, is very much important in this. Next slide. Next slide. Features of degenerative disease are most common in asymptomatic people. Even at the age of 30 years, you may not find any symptom of the degeneration in the patient. But when you examine the patient, you'll find a lot of degenerative changes has happened. Symptoms come only when there's a lot of degeneration. At the initial stage, you want to find the symptoms of the patient. Generally, people older than 30 years will find degenerative changes, but now people in 24, 25, 21, 19, we are finding it because of mobile uses, laptop uses, wrong uses of lifestyle. They create this type of symptoms. Next. So you have to see acute means 3 to 4 weeks, subacute comes from 4 to 12 weeks, and chronic becomes more than 12 weeks, means more than 4 months. So these are the three. Generally, you will get chronic cases, and chronic cases are very easy to recover. I recovered large number of chronic cases, of which 12, more than 250,000 videos are visible in my Facebook findings. Next. Encourage patient to be positive, courageous, and allow them neck movements. You should restrict the neck movements. See, whenever there is a pain or very severe pain, always restrict the neck movement by giving cervical collar. If there is any fracture, give hard collar. If it is a spondylitis, give soft collar with neck pillow. We call it gel pillow. Always try to correct the posture. Sleep with one pillow that we all have told you. Sleep with one pillow which provides lateral. So we call it cervical pillow. There are many cervical pillows available today. Always use cervical pillow. Correct posture if participating or aggravating the parent. So your correct posture only will help you to recover from the acute neck pain. Sleep with one pillow provides lateral. People always take two pillows, three pillows in India to sleep. Even I've seen in Philippines, people take two pillows. It should be avoided. You should sleep always with one pillow. If you have a cervical spondylitis, always use one pillow. Two pillows may force the head into an unnatural position. Using two pillows may make the head into unnatural position, which may cause a severe pain. Clear?
Clear, sir.
Yes, sir.
Next. Discourage the patient from prolonged absence from work. Wearing cervical collar is required for a specific period because it should not move his neck here and there. Immobility of the neck is required, not the hard collar, but soft collar is required. Next, refer to physiotherapy or multimodal treatment. There are various, I told you, never go for chiropractic techniques and all. because it may lead to disc prolapse. We are very much afraid of this prolapse because the bones are osteoporotic, bones are weak. You may get pain relief, but not the recovery of the disease. And if there is a disc prolapse, it may compress the cord and it may damage the cervical area. So never do that. Always be careful while using the technique. Simplest technique I will teach you is using what? Needle and pin. I'll make many more videos of the cervical pain using neck and pain. Acupuncture may be included at this stage. I told you acupuncture in a positive way recovers large number of cases. You will see I have recovered large number of cases with this type of patients and they really recover very fast. Promote positive attitudes to activity and work. Always help the patient to don't go weightlifting, sitting on the floor, weightlifting, looking downward, correcting postures is the most important thing. You must ask the patient to avoid. That is very important for the patient to understand to do this. And if the patient understand this, will get what? Pain-free life, or else he will suffer. Next, address any psychological factors because very good sociological factors also lead to this. Poor patients, they work very hard, lot of things are there. So you have to address the psychosociological factors. It is very important. Sometimes the patient is so depressed that he does not have any psychological symptoms. He may require physiological therapy and occupational therapy. But first rule out whether he is really having cervical spondylitis or not. See, continue physiotherapy, I always advise. But cervical spondylitis can be recovered very nice, beautifully with acupuncture dry needles. Use carefully and the pain is instantly relieved. Patient, your reputation will spread and your patient will spread if you work nicely. The only difference with difficulty between you is that your position and portion and anatomy should be clear. If you do it clearly, you'll get good results. Electrotherapy is not never advised. Avoid this and passive movement, massage. All this is never advised. This is a psychological factors. Always encourage the patient. Otherwise, the patient may never become all right. Next. So where there is a poor control, you should always refer the patient. Never try to take a risk in your hand. No neurosurgeon, no neurologist, no medicine doctor takes the risk. Today is not a time to take the risk. Today is a time for healthy practice. Practice healthy, be happy and stress free. So you can see the summary of the symptoms, what I have written out here. Next. Home massage messages are always there. You must know, maintain the lifestyle. Role of imaging is limited. See, lifestyle is diagnostics and treatment are limited. Lifestyle is more important. These are called non-communicable diseases. There are two types of diseases. They are communicable, non-communicable. So these diseases are non-communicable. If you recover it properly, it recovers nicely. If it does not recover properly, it does not recover properly. Dermatomy, you should see uh, lateral part of the upper arm, shoulder abduction, lateral forearm and thumb, elbow suction and extension, middle finger, little finger, middle aspect of the forearm, anterior skin, middle foot, hallux, and lateral foot and cuff, knee suction and extension of the foot. These are the myotomes, these are the dermatomes. You can say from C5, C6 to T1, CS, S1. So by this, it's a clinical way of neurological examination. Loss of sensation may, in any of this, may require a required. So that is why I could not teach you very well yesterday how to go needle inside and to keep impulse. You may do some wrong procedure. So you must understand first what are the right red flags, what are the not red flags, which case are to be treated, which are not to be treated. If you treat an inflammatory, you must be careful. If you treat a non-inflammatory, you must be careful. Hexagonal neuropathy, all these cases are to be carefully treated. And if you treat a very careful case, you'll get a good results. Next. You may ask me your questions, please. Ask your questions. Ask your questions. No questions?
So may I ask?
Who's speaking?
Lodha from Pune,
Yes,
India.
Mr. Dawda, please tell me.
I just had a little doubt that, okay, cervical spondylosis, as you suggested, can be relieved out of pain with the dry needling and this, but sir, will it be reoccurring because of the structural damage what they
Yes,
have?
yes, yes. There is structural damage even after surgery, it will be occurring.
Okay,
Then
so
lifestyle, see, these are lifestyle diseases. Until the lifestyle is corrected, patient cannot recover. You need around 21 days to recover this pain. Cervical collar, cervical pillow, and the neck collar while traveling. All this is required. You go and sit in the car like this for 10 minutes. After half an hour, you'll have lot of pain in the right hand, left hand.
right, sir. So do we have to suggest them that they need to do needling at least twice a week or maybe once in 10-15 days or something like that, sir?
Twice a week, nothing will result will come out. They need at least 3 to 4 times. It is a danger. It is a very difficult disease because cord is
Okay,
very close to the brain. If
okay,
it becomes myelopathy or something, it becomes, you lose his upper limb and lower limbs. More important is muscles. It's a neurosurgical case. Any type of spondylitis, this prolapse is a neurosurgical case. You are recovering with acupuncture, it is good for him. It is your skill which you are recovering him. Otherwise, the person never advise him for 1 day or 2 days. If you require it, advise him, it's never correct. I never
okay,
advise my patient. I say that if you can come for 15 to 20 days, you come, otherwise you are discharged.
okay, sir. Thank you, sir.
More questions?
Hello, I'm Gandhi from Chandigarh.
Yes, yes, sir. Please tell me, sir.
When I was student of master degree in physical therapy at occupational abroad, there was a subject study given to me on cervical spine and lumbar spine. Study was
Sir,
conducted by me for 3 years together, and it was an absolute comparative study of cervical spine as well as of lumbosacral spine of various persons involved with occupational, various occupations. Radiologically, they have been reported persons having severe Osteophytes seen at various places in the spine, maybe lumbar or cervical, along with curvature is totally lost, but the patients were symptomless. This became a question regarding image technology. That is, at that time it was only X-ray. Uh, X-ray says patient must have severe problem, severe symptoms, can't manage well, but they were symptomless. So
You are right,
X-ray and
sir.
MRI, these are
You are
study
right,
of
sir. In
image.
most of the cases, we see is no symptoms. You're right, sir. In most of the cases, we see there
Asymptomatic.
is no symptoms. But on the other cases, we see the patients are having heavy symptoms, and we are not able to diagnose which kind of case it is. We
But
see the
later
symptoms
on,
and we treat the disease.
sir, I may,
So always
con-
better to go with the
sir,
investigation
I may conclude
to see.
the conclusion of the study was very simple that image study is never confirmatory and never can be 100% okay. Whereas the muscle, surrounding muscle, which provides support to the structure was strong enough, and those persons were without symptom, asymptomatic. This was the
Just see,
last
in many
result
cases,
of the study.
it is very difficult to define when we speak about cervical spine or any other cases. Even in the cancerous cases, even in the fourth stage, we don't see the symptoms. Just before a few days before his death, we see the symptoms. So it is very difficult for us to define which under which case it falls. So investigations, if a patient comes with anything, regular investigations, putting up things, checking up yourself is never a wrong. And abstaining from your lifestyle disease is very important. Do healthy exercise, play footballs, play badmintons, play all these games. Yeah, it will recover the patient.
All the movement reversals and those. Cervical spine is flexed, whereas it must be extended. First, activities which involve extension of cervical spine are to be carried out. It is first. It's a
Yes,
yoga also. In yoga, similar things we are doing. Whatsoever we are not doing in the day, we are doing every in the morning in various
I will
yogic
tell
postures.
I've been having myelopathy from last 7 years, cervical myelopathy from my last 7 years, and I'm practicing a healthy practice. Nothing went wrong, and I'm doing good with the help of what? I practiced
Sir,
5 days, 6 days
prevention
in a OT room. Continuous practice, nothing went wrong. And even today, I
sir,
practice around 70 to 80 patients. Nothing goes wrong.
sir, prevention is always better than cure.
So this is what I say,
We
all
should
of
have
you.
preventive measures.
You should prevent yourself, be happy, and be careful in selecting your cases. Right cases and wrong cases should be very carefully selected. Try to save the life of the patient. Patient will be always happy. Neurology is a subject which is only a palliative care, and rest we have to see how much we can help the patient.
Sir, one thing more I will let you know. I am still in learning phase. By attending your these classes and previous lectures, I added lot of things in my knowledge and practice too for the benefit of suffering and ailing humanity. So our profession is basically always to learn and have good things from everywhere.
See, every day when I go to the clinic, I learn a lot of things. I found, oh, this is another critical case which how has to be recovered in a minute. I take one needle, I specify, I put that location, I put this pain on the needle, and then I remove this needle, and then you see the radiculopathy is subsided. It is an irritation of the nerve root which subsided. It becomes very difficult for us to define how it happens. But then we say after 6 months, 7 months, the patient does not have any deficit. Even after years, we do not find deficits. My experience is of 30 years in this field. So am confident that this will have a deficit. Even the cases which are having chronic myelopathy, they should not be operated. Neurosurgeons, they deny operations, and we recover those cases.
For a neuro problem, diagnosis is pinpoint, but treatment is negligible. It's my
Neuro
personal
problems, yes,
experience.
diagnosis is very important because if you
It's a
don't diagnose
pinpoint.
it properly, patient is going to suffer
It's a
very
pinpoint.
badly.
treatment is not so good.
And
Sir,
neuro
I
is the
learn a
field
lot.
where there is lots of expenses.
Sir, one more thing I may say, please arrange some lectures on pain control theory, how pain is being controlled and how created. For all the persons, those who are
Yes, sir. We have
basic and
already
learners.
arranged. We are going one by one. First of all, I wanted to tell you that cervical pain can be managed even with radiculopathy. Second, I wanted to teach you some anesthetic procedures by which headache and all this can be reduced with the help of these dry needles. Now, more and more lectures are there. Classes have not completed. More and more you will learn.
Sir,
The
please
more you will
include
learn,
me
the
in those
more
classes.
expert you will become.
Please include me in those classes. It's my humble request.
Thank you so much, sir, for your kind support and blessings.
Okay, sir. Okay.
Any more questions from anyone?
Sir, this is Anand Maurya.
Moria, please tell me.
Sir, where you exactly put the needle may be it is just
That is the location only is the important.
yes, if find the corresponding dermatome
Yeah,
or
no,
the
no, not the
myotome.
control. The selection of that area is only what you have to learn and how much intensity has to be given. And you can recover the patient in what? Within 5 seconds, 10 seconds. In sports injury, you will see large number of patients have recovered, and the patients, when with prolotherapy and all, we have developed a very good stem cell therapy in 3,000 rupees. And now we have found out that it is much better than prolotherapy, and the patient recovers very fast.
I also got result from the NIBS using the brain and muscle span in the cervical and the back. Even the Abhishek mothers, we can also use the brain and muscle span where the
Yeah, because it
compression
releases
fracture.
the spasm. Most importantly,
Yes,
part is the spasm. Once the spasm
yes,
is released, the arterial circulation starts. Correction of the lifestyle results to what?
yes,
Arterial
yes, sir.
circulation and fibrosis of the disc prolapse, which
We just provide a particular
helps the
place.
patient to move away from neurosurgical procedure or complication of spondylitis. You're very correct. And Moriaji, you have done a right procedure.
Yes, sir. After stimulating, the patients feel more comfortable, more stable.
See, for sports injury, for all these type of cases, you see around 80 patients, I'd say around 120, 30 patients of we discouraged cases, right?
Yes, sir.
But then also we are happy to work and we recover the patient very fast. Why? My clinic is fast because I can recover the patient faster than in a day. You will see my clinic is full every day. You won't find a space to put the leg also.
Yes, sir.
So
Even my lateral collateral ligament of the knee is strained. Then I have to just apply the brain and muscles. Even the stair climbing is too difficult for me after applying the brain and muscles pen. Uh, it's just feel there is some crepe bandage or kneecap is there, uh, which make a such a stable joint. So the climbing and down stair is so easy for me. It is just by applying the brain and muscle span.
you are right. See, body has its own healing mechanism, like kind of a yeah, you are right. We call it target drug delivery. Body has a capacity to develop these targets of the drugs. Whatever drugs we use, lot of toxins, poisons in our body has a capacity, but beyond the capacity, body cannot tolerate. So when you do NIBS, body tolerates new pathways to recover the targeting area. We call it the target pathway. So the target pathway is achieved and non-repeating injury recovers the patient.
Yes, definitely within a 3 days, my knees is perfectly okay.
Right? That is why the role of acupuncture in physiotherapy has become very much must, because it quick recovery, no complications, and
Because it also
the way you
reduce
are
the
using
pain.
dry needle functionality not only reduces the pain, it recovers the symptoms and disease also.
Even it is strengthen the muscles. That's why I feel it's so comfortable. My knees is so stable.
Yeah, it strengthens the muscles. I told you it is called target drug delivery. So if you use brain muscle pain, if you use advanced brain stimulation, you can see how much patients of paralysis, difficult cases of paralysis, we recover very fast and very quick.
Yes, sir. But sir, where the exactly
Okay,
is
then
the
any more
needle?
questions?
Needle, sir, where the exactly needle is put on the spine, that is lateral to the spinous process?
See, it has to be selected. The location has to be very carefully selected. You must know the
As per
anatomy
the
very
clinical
carefully.
finding.
Yeah, it is about the clinical findings and the anatomy, which has to be clinically learned. Doing anything non-clinically will always put you in trouble.
Yes, sir.
Any more questions?
Sir, please provide the PPT of the dated 18th and 19th.
No, with that purpose, this is an anesthetic PPT which I will not provide. I will
Okay,
provide
sir.
the videos because you people are not, some people are good, but some may create lot of problems for the patients. And then it may create lot of troubles because
Okay, sir.
people are not well versed with techniques.
Okay, sir. Okay.
So you learn with the video, not with the PPT. Providing PPT may give a legal obligation on me.
Okay, sir.
Today there are a lot of medical litigations. It may provide a medical litigation on me. Any questions? Any more questions? Any more questions you want to ask? Any more questions you want to ask? Okay, then thank you so much. It's 9 o'clock. We finished the class.
Thank you so much, sir.
Thank you,
Thank
sir.
you, sir.
Sir.
Thank you so much, sir.
Thank you so much, sir.
Good night.
Good night, everybody.
Thank you,
Have a
sir.
lovely rest.
Good night, everyone.
Good night, everyone.